Hey, it's me, Dr. Wendy, coming on today to talk a little bit about neonatal jaundice and kind of what to expect or what that is. There was this recent case in, I believe, Texas, where a baby was forcibly taken from some parents. I don't want to talk about what happened exactly, but I do want to talk about jaundice because it is a little bit unnerving to know that that's something that could kind of prompt such a significant response. And I just want to go through that. So, neonatal jaundice is basically a overproduction or overpresence of something called bilirubin in a baby's blood. Bilirubin is a breakdown product of blood. And so you may have heard of jaundice when you think about people who have like liver damage or like need a liver transplant, their skin turns yellow, their eyes turn yellow. That can happen in babies. And some of the causes can be bruising during labor. Sometimes it can be an incompatibility between mom's blood type and the baby's blood type. Preterm babies are more likely to experience that. Babies who are born over 38 weeks are probably the least likely to experience it, but babies born under 38 weeks, it can happen. It happens rarely, and most babies don't require any treatment, but it can be severe. It typically will occur within the first 3 to 7 days of life. So babies are often tested in the hospital, and then they're usually tested within a couple of days after discharge to make sure that those levels are not elevated. What can happen if those levels become elevated? Well, if initially they're slightly elevated, the idea is to reduce them because the severe cause or the severe effects of high bilirubin, there can be something called an encephalopathy that can develop, which is actually a brain issue where the bilirubin actually gets into the brain. It can cause the babies to be really lethargic, really listless, not feed well, cry in a very characteristic way. And then in really, really severe cases, it actually can cause brain damage. It can cause cerebral palsy. Babies, their eyes can be kind of fixed up. They can have difficulty hearing. They can have developmental delays. I mean, it can be like a lifelong problem. That's actually called kernicterus. Kernicterus is the brain damage, irreversible brain damage that can occur in untreated high bilirubin cases. Risk factors, I told you preterm births, actually breastfeeding is a risk factor, although breastfeeding is recommended to help to prevent it. So it's kind of weird that breastfed babies can sometimes have lower calorie intake and lower fluid intake, which is a risk factor for developing jaundice. But breastfed babies actually eliminate the bilirubin better. So if a person is able to breastfeed, we recommend it, but we want them to try to breastfeed like 8 to 12 times a day, I think is the recommendation, to keep the calories and the fluid going in. And sometimes breastfed babies, if they're developing jaundice, the babies will still need like IV fluids or supplemental formula just to keep those calories and fluids going in. Treatment, so prevention is like fluids and making sure baby is getting the milk or the caloric intake calories in, and also monitoring, right? Like making sure that the levels are not getting to a dangerous level. Treatment actually is something called phototherapy. So if the levels get too high, we actually need to put babies under a special light in order for them to break down the bilirubin in their bloodstream and eliminate it in the urine or stool. So babies can be under single phototherapy or triple phototherapy. Story, all three of my kids were jaundice. All three of them. Two of them were born a little early. One was 36 weeks, one was 37 weeks, but one of them was 40 weeks, and all three of these kids had jaundice, all under triple phototherapy. Single phototherapy is like a single light on the baby, like this particular type of light that makes the bilirubin break down so it can be eliminated. Triple phototherapy is that light that's like almost right up against their skin, and then there's like lights from all directions. They are in this little bassinet that like, and they have this little sunglasses. It's actually really cute. I have pictures of all three of my kids under the triple phototherapy. It's cute, but it's not, because you're like, man, this is a stressful time, right? But I mean, the point is, I am a experienced person when it comes to having babies with jaundice. And so that triple phototherapy is actually like super important and can take hours. When I tell you these babies would have to be under these lights for like 6 and 8 hours, we would take them out to feed, put them right back under the lights. And the levels, you see the bilirubin levels go up, 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 up. And then finally they start to plateau, and then they start to turn down. And that's when you can start taking them off of the lights, because the process fixes itself typically within that first week of life of the baby. But again, if you don't catch it and you don't stop it before it gets severe, these babies can actually have lifelong complications related to babies' jaundice, related to neonatal jaundice. So I just wanted to jump on here and just kind of give some perspective about that. When they come in, they say, hey, I'm checking these bilirubin levels, is to make sure that those levels are not crossing a certain threshold where we have to not only monitor more closely, but possibly need those lights. And if we need the lights, it's temporary. We're talking about, a couple of days of continuous, periodic monitoring and lights. But then it's going to turn down and it's going to fix itself. We have very effective ways of treating jaundice and preventing that like long-term issue, as long as we're catching it and we're treating it. I hope that shed some light on neonatal jaundice and kind of like what that story is. Drop some notes or something in the comments if you have any questions about that particular scenario. All right, talk to you soon. Bye.